Hello, and welcome to this educational series called Welcome to Medicare. This program is presented by the Wisconsin Department of Health Services, which is responsible for the Wisconsin State Health Insurance Assistance Program, otherwise known as SHIP. SHIP is a federal program, which means each state has a SHIP program. The state of Wisconsin has SHIP counselors available in every county to help with your Medicare issues. In Wisconsin, you can find a SHIP counselor in your area by going to your local Aging and Disability Resource Center, or ADRC, or you can call the SHIP helpline. The phone number is here listed below. It is 1-800-242-1060. I work as a SHIP counselor for the state of Wisconsin. So if you are deaf, hard of hearing, or deafblind and live in the state of Wisconsin, you can contact me. My VP number is listed below, and it is 262-347-3045. Otherwise, you can email me as well. My email is jenniferm.kane@dhs.wisconsin.gov and is listed below for you as well. If you're from another state, you can still reach out for a SHIP counselor in your area as well to help you with any of your Medicare issues. This presentation will talk about Medicare basics and their different parts. And it will also touch on Medicare Part A and B. You can find more in-depth information about your Medicare benefits in the Medicare handbook, which is mailed to everybody who is currently a Medicare beneficiary. Or you can find it on medicare.gov as well. I encourage that you watch this information in order so that you have a better understanding of Medicare. Welcome to part 2 of this educational series. In part 1, we talked about how and when you should enroll in Medicare. Now we will talk about Medicare basics. The chart that you see on the screen is a summary of what Medicare Parts A, B, C, and D cover. Part A focuses on helping to pay for inpatient care while in the hospital, in a skilled nursing facility, or while in hospice. Covers some home health care and blood that you receive as a patient as well. Part B helps you to cover the doctor's services, outpatient care, home health care, and other preventative services. Medicare Part A and B are considered original Medicare. Then there is Medicare Advantage, which is also known as Medicare Part C. Some people prefer to call it the Advantage Plan. Some people prefer to call it Part C, but it is the same thing. So this is an alternative to original Medicare, which is Part A and B. The Advantage Plan includes Part A and B and sometimes Part D services. This is run by a private health insurance company that contracts with Medicare. And the last part is Medicare Part D, which pays for costs of prescription drugs. These plans are covered and run by private health insurance companies as well. They must follow the contract and the rules that is established by Medicare. So let's get a closer look at what Medicare Part A benefits are. So Part A helps with the costs of inpatient care. So for example, in the hospital, semi-private room, meals, general nursing, and other hospital services and supplies. It also includes inpatient rehabilitation facilities and inpatient mental health care in a psychiatric hospital. That, though, has a limit of 190 days for a lifetime limit. It can help pay for inpatient skilled nursing facility care. Part A can help pay for blood that you may receive as a patient staying in a hospital. It can pay for home health care or hospice care as well. So Part A does not cover a few things. One is a private duty nurse, a private room, TV or phone in your room if the hospital charges separately for those services, personal care items like razors or slipper socks are not covered. And it does not cover custodial care. And that means non-skilled or non-medical care in a nursing home. So that is something that can safely be provided by a non-licensed care facility. So for example, bathing or dressing, that's something that wouldn't be covered by Part A.
Most people do not pay a premium for Part A. There is a deductible for Part A, and in 2022, it is $1,556. The deductible is based on benefit periods, which lasts 60 days. A benefit period begins on the day you're admitted to the hospital or a skilled nursing facility as an inpatient. The benefit period ends when you haven't received any inpatient hospital or skilled nursing facility care for 60 days in a row. If you go into a hospital or a skilled nursing facility after one benefit period has ended, a new period begins. You must pay the Part A inpatient hospital deductible for each benefit period. Benefit periods can span across calendar years. For example, one period can start December 21 and end January of 2022. There are no copays when you are an inpatient in a hospital or a skilled nursing facility. We'll look at those on the next slide. No copayment is required for home health care or hospice care. And there is no out-of-pocket maximum with original Medicare. We'll talk about Medicare supplement or Medigap insurance and how it can help you with these costs in the next section. This chart shows the 2022 Part A costs related to inpatient hospital stays. So we will discuss three different things. So for the first 60 days in the hospital, the patient is responsible for the deductible and Medicare pays the remainder of the covered cost. So for days 61 to 90, the patient is responsible for $389 per day and Medicare pays the remainder. For days 91 to 150, the patient pays $778 per day and Medicare pays the remainder. This chart is the 2022 cost for Part A related to skilled nursing facility or an SNF. So for the first 20 days after the deductible is met, Medicare pays all of the covered costs. For days 21 to 100, the patient is responsible for $194.50 per day, and Medicare pays the remainder. Medicare does not cover any SNF costs after 100 days.
Hospital status is very complex. It's a medical decision that's based on your doctor's judgment and your medical needs while you're staying in the hospital. Inpatient is you are formally admitted into the hospital with the doctor's orders. If the doctor has not actually filled out an order for you to stay as inpatient, you are considered outpatient. So for example, an emergency room is considered outpatient. If you are admitted to a hospital for observation, that is still considered outpatient, even though you may be staying overnight in the hospital. Medicare Part A will not pay any of the outpatient services. Part B would pay for the doctor's services and the hospital services that are on outpatient status. And that is after you meet the deductible and the coinsurance that is required, as well as the copays. Prescriptions that you receive while you're there for observation, you most likely will have to pay for yourself out of pocket. And then you would submit a claims form later to the prescription drug plan for a refund. You can request an out-of-network claim form as well through your plan. If you're in the hospital for more than a few hours, I suggest you ask your doctor or the hospital staff about what your status is. The hospital is required to let you know whether you are inpatient or outpatient, or if you're there for observation only, especially if you're there for more than 24 hours. So let's get a closer look at Medicare Part B. Part B helps to cover medically necessary outpatient services and supplies that include the following things like doctor services, outpatient medical and surgical services and supplies, clinical lab tests, durable medical equipment or DMEs. Maybe you need to use certain supplies that insurance won't cover, diabetic testing supplies, preventative services, for example, the flu shot or your yearly wellness visit, and it will cover home health care.
B standard monthly premium is $170.10. It may be higher for people who have higher income. The Part B premium may be deducted from your Social Security check. If your Part B premium is not deducted from your check, Medicare will bill you. Medicare Easy Pay allows people to have their Medicare premium payments automatically deducted from a savings or checking account each month. There is an annual deductible for Part B. In 2022, the deductible is $233. For most covered services, like doctor's services and some preventative services, Medicare will pay 80% of the costs, and you will pay the coinsurance, which is the remaining 20%. And that's as long as the provider accepts Medicare. Many of the preventative services are covered in full and do not require coinsurance. Since 2007, people with Medicare who have higher incomes have paid higher Medicare Part B monthly premiums. These income-related monthly premium rates affect roughly 5% of people with Medicare. This chart shows the 2022 Part B premiums for people with higher income, and the amount is based on your tax return from 2 years earlier, or year 2020.
Medicare Part B covers 2 preventative services. So welcome to Medicare visit, and then the annual wellness visit. There are many other services that Medicare Part B will cover, such as additional screenings and services that are meant to help prevent disease or catch medical issues earlier. So preventative services can be found in your Medicare and You handbook. I highly encourage you to review that handbook and then discuss with your doctor. Your welcome to Medicare visit will happen within the first 12 months that you are signed up for Medicare Part B. It's important for you to know that this is not a physical. It's not a head to toe exam or visit. This visit will include the things that are listed on this slide. You will also talk about your medical and social history related to your health. When you make this appointment, let the doctor's office know that you would like to make your welcome to Medicare preventive visit. This is covered and approved by Medicare, including the deductible and copay. If you have additional services or tests that are needed, you may have to pay some co-insurance, and the deductible then may apply. Once you have Medicare Part B for more than 12 months, Medicare will approve the yearly wellness visit. The point of that visit is to create an updated preventative plan based on your current health needs and your risk factors. You need to complete a health risk assessment that will help your doctor better understand and know your personal preventative plan. Your yearly wellness exam is covered and happens once every year. There will be no charge. It will not include a deductible, and there will be no co-payment required. Unless you receive additional tests or services, you may be required to pay co-insurance or the Part B deductible. You should ask specifically for the yearly wellness exam. Use that name so the doctor's office knows. Again, this is not a physical. Medicare does not cover, Medicare Part B does not cover the physical. So you may be responsible to cover the full cost of the physical if you have it, because Medicare Part B does not cover that. So this is the end of part 2. Welcome to Medicare Educational Series. I hope this information was helpful. In part 3 of this series, we will talk about your insurance options, which includes original Medicare and Medigap insurance. This presentation was hosted by the Wisconsin Department of Health Services SHIP program. SHIP is a free and local resource available to people who have Medicare. Each state has a SHIP program. So you can contact your SHIP counselor in Wisconsin to learn more about Medicare. You don't have to do this alone.